So Angie, look, thank you for your time today. I know you're busy. So how long have you been with Hodge now?
2018,
2018.
5 years.
So in the 5 years, how has it helped your practice in terms of fighting declining reimbursements?
Mm, yeah, absolutely. So adding another bucket of revenue through diagnostics, we've
Mhm.
been able to increase our dollar amount, our collection per visit
Yep.
that we're seeing. Something that we've kind of measured over time. And
Hmm.
it has allowed some of that, some of us to then combat the raising rates of salary and inflation
Right.
from bringing therapists on as well.
Yep. So let me ask you this, right? Because I talk to practice owners. My purpose is to help them with their practice, help grow their practice with the idea of diagnostics, right? That I've had and you have. Sometimes practice owners will tell me, well, it's not the right time for them. They have other things going on in their practice. So when you made the decision of diagnostics and putting it in, did
Mhm.
the idea cross your mind that, well, I don't know, is this the right time? We're managing so many other things in our business. You guys do a lot with athletes, right? And
Yeah.
other things in your program. So did it ever cross your mind when you were thinking about diagnostics that maybe you didn't have enough time to devote to it?
Yeah, absolutely. I can empathize with that. Joe and I were husband and wife practice owners, and, we eat, breathe, live this place. And we all, we're just like every other owner, like, mom and pop, we've got there's not enough hours in the day. There's not enough
Yeah,
time, right? And then
yeah,
when you think about, I'm going to implement this whole new service that obviously there's a cost, upfront to do that. Like,
yeah.
oh my gosh, like, do I have the time to do that? And, when
Mhm.
those thoughts started crossing our mind, really, we looked at from the standpoint of this is not just bringing in like, let's add a like little piece of equipment or something,
Yeah, right.
let's
Right.
let's put some therabands over there, let's
Yeah.
add this little program or whatever. Like this is a big thing. And in that, for it to be of that significance, we understand that nothing of that significance is going to come easy and come quick, right? And so
Mhm.
it was very much our mindset of this is going to be a marathon. This is something that is going to be the good for our practice for many, 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 many years to come.
Right.
Not just like I'm going to implement this small little, sprint of a
Yeah.
race and it be done next week. So just wrapping your mind around the fact that this is a marathon. And I'm going to take elephant bites, you know, at a time, but
Hmm.
the success has just been, has continued to build year over year.
So that's interesting. So you had this idea that maybe what it wasn't the right time because you have other things going on, but from your perspective, it was like, well, I'm investing my time in this area for the greater good of my practice now and for down the road.
The one thing
Yeah.
that I thought of, Dan, that may also be of value for other owners is when we implemented diagnostics, it was coming off of we had Hurricane Irma the
Hmm.
year right before that, or 6 months, 3 months or so right before that. And so we were in a bit of a period of chaos and
I bet.
rebuild.
Yeah.
And I also believe that that was one of the things that, pushed us to, okay, we are in this chaotic situation. What are we going to do different? How are we going to? And
Hmm.
I feel that our whole profession right now is in this chaotic
No, you're right.
situation.
That's a good point.
I mean, when you look at reimbursement, when you look at staffing, when you look
Hiring. Yeah.
at payroll, when you look at therapy, like the
That's
shortage
a
of
hurricane.
PTs.
That's a
It
hurricane.
it is. We are in PT, the world of PT right now. The profession is in
Yeah.
a hurricane. I've been through two majors. I can speak to this.
Yeah. Yeah.
um,
So
and
that's
so
interesting. So
really,
you were right after you had gone through a hurricane, and then you were entertaining. Do we start this whole diagnostic program?
yeah, I met Demi in 2017. We had Hurricane Irma in September of 2017, and I was a partner by 2018. So
So
that's
let
how
me
that happened.
ask you this then, because that you very easily could have looked at and said, well, this is definitely not the right time to start diagnostics. We just had a hurricane. So honestly, why did you say this is the time? So you've gone through this hurricane. Did you have damage to your clinics?
We did. We
You
did.
did. So why did you make that decision that, you know what, it is the right time, even though you just went through this?
Yeah. So understanding again, like we need to build ourselves back up, but we need to do it stronger.
Hmm.
And we need, if we keep doing what we did pre-hurricane, it was almost like a reset, right? If we keep doing what we did pre-hurricane, we're going to keep getting the same thing we got and then worse.
Right.
So this is the, in my opinion, it's a perfect time. Out of chaos, we create something
Yep.
new.
Yep.
And that's, that's what we did. So
That's interesting. So that's interesting because even now, private practice owners spend a lot of time in the practice, right? They're working harder than ever,
yeah,
getting less and less reimbursement.
yeah,
So the argument could be, why are you investing all this time in one area that keeps getting declining reimbursements if you can invest
right,
it in another area
right.
where you can 6 times the value of what you're putting in? You could actually spend less time in the business because you create more value for it because it's so much greater. You follow?
100%.
Interesting.
Absolutely. So just having, your one bucket of physical therapy, that was
Hmm.
really scary. Like, that's only one bucket. Now to have another bucket of diagnostics that really, complements and increases revenue there. And then, we did a whole nother thing with like personal training and whatever, but like
Yep.
adding these extra lines of revenue and streams of
Mhm.
revenue. And, obviously, especially with diagnostics, that was,
Strengthened the practice and
yeah,
made it more viable. Yeah, that's
yeah,
awesome.
yeah, yeah,
That's awesome. Okay, cool. Now let me ask you this.
yeah,
So, you know, you come into it, there is a financial responsibility, whether someone pays, I don't know, whatever they pay, 50, 59, put down a down payment. So as a practice owner, you're writing a check for a down payment, and then you have these monthly expenses, right? So that could be and I talk to practice owners that have 6, 7, 8, 9 clinics. They're a big operation that still might have a difficult time wrapping their head around. Well, I got to write a check for 20 grand, 30 grand. How now I got to pay 3, 4,000 a month. Now I
mhm.
have to train. So speak to how you looked at that and said, oh, this still makes financial sense to us. Like, what was the decision making you made?
Yeah. So again, I'll go back to that. It's a marathon, not a sprint. Like I knew there would be that initial investment up front,
Yeah,
and and we spread ours, monthly payments. We took out, a loan for 5 years. Like I'll be transparent about that, and we spread
yeah,
it across 5 years.
yeah.
And but I knew that again, this is a marathon. Like this is going to take our practice in a new direction where eventually, like
Yeah,
this is going to pay off and then some,
totally.
right?
Yeah, yeah.
And now we're seeing really that reaping
Mhm.
of reward now, because all of that initial investment that has been taken care of, all of the equipment has been paid off at this point.
Yeah.
um and now we're just, and in that same time, like we're growing, our clinicians around this diagnostics piece, to where then all of a sudden it just like fully blossoms. So
So let me ask you this. So now, here you are today, 2024. We've seen some declining reimbursements. How has the reimbursements from diagnostics help you offset that? I
I
mean,
mean,
I guess it's just the
been huge.
obvious. Yeah, the obvious. You're making more money in diagnostics, but I
Yeah,
mean, how does that help you as a practice owner take care of your staff more, give them more opportunity? Do you have other staff
yeah.
interested in the diagnostics or anything like that?
Yeah, I'd love to speak on providing my team better opportunity. Um,
Yeah,
they are especially, well, e- especially the younger students, our younger PTs, but even my seasoned PT, who she's been in the field for, I think, 10, 12 years.
yeah,
She's looking for something more, looking for something different. What can I do to expand my skill set beyond, your normal manual therapy, OCS, which by the way
yeah,
doesn't pay you anymore if you're an
right.
OCS.
Yeah,
Like
yeah,
what
I know.
what else can I do? Manual therapy, we know it's like one of the least paid codes from an
Yeah,
insurance company. Like why, what, but at the same time, not just from a financial standpoint, but what else can I do to really, again, expand my skill set? And
professional
so
growth.
when,
Yeah, yeah,
yeah, so when I, speak to other therapists, or when we speak to new grads or students, and, tell them about the ability to become a diagnostician through MSK ultrasound and EMG, it's like this whole new world lights up to them, like, whoa, this is,
Mhm.
wait, we can do what?
Yeah.
And I mean, it's super cool to be able to provide them that. And I mean, I believe that's where the profession needs to go. It
Yeah.
follows suit with being a doctor of physical therapy, right?
So I know your husband's board certified. Do
Yes.
you have, so you have other staff? Can you speak to any involvement some of your other staff have in the diagnostic program? Like you have
Yeah,
your one
so
direct, you have a director there, right?
I do.
Yeah,
Um,
yeah.
I have two other PTs right now that are currently going through the RMSK program.
Okay, ultrasound,
Um,
yeah.
yep. And then Joe is also uh, he's finished his fellowship in but he just has to sit for his RMSK, actually his test.
Yeah.
So then he'll have both credentials. And then we have, actually, it's pretty cool. We had a new grad, or a second year PT student, reach out to us because Joe was the only PT around that is board certified ECS, and was
Hmm.
like, I'm doing my research on, some EMG stuff. Can I come shadow with you?
Oh, that's cool.
And he has become like one of the greatest, well, one of the greatest things that's happened to our practice, because we feel like he'll have a place with us because this is what he really wants to do after
How did he find
graduation.
out? How did he find out that Joe was doing, ultrasound or
The
diagnostics?
school, yeah, so the school actually reached out to Joe and said, hey, you're the only ECS anywhere around, and the boards are starting to ask more questions with regards to interpreting EMG results and this, that, and the other. Would you be willing to speak at
Oh, wow.
university around EMG? And so that's
Hmm.
kind of, so this opens up, I guess what I'm getting to here is,
Yeah.
this opens up a new recruitment
Yeah.
arena as well. So yeah, it's pretty cool.
That is awesome. That is awesome. Yeah, actually, I just thought about this. So, in terms of the community, like, what about referring doctors in terms of, so you have had referring doctors send to you before, and now you put diagnostics in. What is it like now? Do you have doctors? I mean, when we did diagnostics, we had some neurologists maybe not, so happy about it, but we had a lot of other doctors that loved what we did. So, what's that been like for you guys?
Yeah. So I can't, it's hard for me to speak on physician. We are very much community-based marketing versus physician-based marketing. So I feel like where I can speak to it is that we've been able to market to our community that we have something that other practices don't have.
Yeah.
And, people will drive to us and pass 5 other clinics to come to see us
Hmm.
because of that we're able to utilize this technology. Most specifically with ultrasound, because not only do we do it to kind of diagnose in the beginning, but we do it throughout their treatment to watch their treatment
Hmm.
progress. So
Yeah.
when you can actually show somebody that their, supraspinatus is healing, and guide their and dose their exercise prescription and their return to sport based on that, that's amazing.
Yeah, it builds their
That's like,
confidence in what you're doing.
yeah,
Yeah, yeah, that's
that
awesome.
makes you completely different than down the street that just has you doing the therabands over here and says, yeah, I think you'll be ready in like 4 more weeks to go back.
That's
Right?
true. That's sick. Yeah,
The
yeah.
personal trainer can say that these days.
Right, exactly.
Right?
Right.
So
That's
yeah.
cool. That's cool. And let me ask you one more thing. You had mentioned about staff and getting staff buying in the
Yeah.
fact that Apex has
Yep.
diagnostics. So how have you successfully gotten your staff to buy into this concept of diagnostics? I know you mentioned like the purpose and so forth. So kind of speak, if you could speak to some of that, how you got them rallied around it.
Yeah, no, absolutely. Again, it goes back to as the visionary and as the owner or the CEO of the company, right? Like making sure that in the beginning, at first, I spoke around diagnostics. We're doing diagnostics. We're doing these tests. Let's do
Yeah.
these tests.
Okay.
Let's do these ultrasounds. Let's do these EMGs. And it was a little bit like, I don't know what she's talking about. This isn't what I learned. I don't know what this is.
Right.
Um, And then it transformed into, wait a minute, why are we doing this? And so when I was really clear on purpose and really spoke to them around purpose and was able to shift that mindset of, we're not just doing an EMG. What we are doing is, we are being a primary care provider. This patient is coming to us. They have sciatica. We need to know why and how we're going to treat them the best. And we have the best tool in our toolbox to do that and to make sure that our plan of care is appropriate for them, or do we need to refer them, right? And
Okay, right.
so when we're being autonomous, we're being doctors of physical therapy, so when I spoke all around like what this purpose is and how this is how we can change the lives of our patients better, this is how we can give them more value, this is how we can get them better faster, this patient-centered focus, again, and not that I believe that wholeheartly, but just as owners, sometimes, our minds are a little different than how they think. So.
We're looking at P&L a lot.
Yeah. So understanding that in providing them the purpose and the vision, the buy-in, completely did, a 180.
So they saw the value of it and how it would help them and their patients.
Yes, 100%.
Just curious too, did any of them kind of like, we're treating one way and then you do a diagnostic test and you're like, oh, we thought it was this, but it's really this, and you actually change the treatment, right?
Oh my gosh. It happens all the time.
I know.
It happens all the time. I think now I could never go back to trading without these tests.
Yeah.
I look now at how, like, I would treat a shoulder, or how I would treat sciatica, or how I would treat any of it's unbelievable. Like the difference.
It's like, how'd you do it before without it?
Yeah, it is. It really is. Like,
see, that's when you start realizing the significant benefit to the diagnostics, to the test, the tools that make us better practitioners, right? Like you said, primary care, and that's where we want to go. So that's awesome. That is so true. So awesome. Look, yeah, I appreciate it. I do.
Yeah.
You guys are awesome. Your practice is fantastic.
Thank you.